Well, seems like Mr. Duckett dropped another bomb on Albertans, so we're down in Red Deer to see what they think about that. We're going to the Red Deer Lodge, where there's be a healthcare rally, and I expect a lot of people. Should be emotions running high as well. People are starting to figure out that their healthcare system's getting pulled out from underneath them, right? So I would be surprised.
Save our healthcare! 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 Save our healthcare!
The people are here today to protest the funding, the pulling of the funding from Alberta Hospital and the infrastructure that was supposed to be completed there. And they've pulled the funding for that, and we think that's just wrong.
Mr. Stelmach, just think about the everyday, ordinary people on the streets and save Alberta hospitals, as well as some of the health care that you're hacking on. Think of us. We're the people, and we're the ones that vote.
Well, we were originally told around 150 beds were going to be gone. We now find out that it's over 250, around 250, and that the forensic unit's the only one that's going to be left open. We think there's a world-class facility there, and we don't want to see that facility closed.
Mr. Stelmach, my name is Dean Cunningham. I live in the town of Ponoka. I work at the place that used to be called Alberta Hospital Ponoka. It's now called Centennial Centre for Mental Health and Brain Injury. I'm a registered psychiatric nurse, and I've been working there for over 35 years. The things that your government is doing at Alberta Hospital Edmonton, farming out 246 beds, is wrong.
Alberta Hospital Edmonton takes patients and clients from all over Alberta. It's not just, and Northern Canada for that matter. It's a provincial thing, it's a Western Canada thing, it's more than just an Edmonton thing.
Well, this is essential now. These are the people who actually deliver health care to Albertans, and their message is the most clear and concise. If you narrow the scope of public health care, Albertans end up with less health care, or they have to pay out of their pocket to make up the difference. It's as simple as that. People in Red Deer and area shouldn't stick their heads in the sand and think that they dodged this bullet. If you are taking acute care beds out of the system, then smaller hospitals are at more risk, in fact, because you have less surplus before that hospital, in fact, loses its capacity to even be a hospital or to even be a healthcare provider of any kind. And so don't think that you've maybe dodged the bullet here today, that Mr. Duckett's not going to come knocking soon enough. And you have to be ready for it. We all have to stand together now to say what sort of public health care do we want for ourselves and for our children. Albertans want our public health system improved, not taken to pieces like Mr. Duckett is doing.
They say privatize, we say no! They say privatize, we say no!
When you look at what the Stelmach government is doing, what's happening is it is a form of privatization. They're cutting beds. They're saying they're moving them out to the community, but they're moving them out to for-profit companies. So basically, it is a step in the direction of healthcare privatization.
Government doesn't give Albertans the time of day to know what's going to hit them next. It's like we're getting punched in the corner here. And, Mr. Stelmach has to step back and realize what his job is, to provide safety and security for all Albertans. And he's supplying neither of those now. All he's doing is making people nervous, and we're worried about where our loved ones are going to end up.
Save our health care!
Mr. Stelmach, the Public Service Alliance of Canada is here with our AUPE brothers and sisters, demanding that you stop these ridiculous cuts. Ridiculous. Federal people are here, and we want you to know this isn't a good thing for you. Stop it.